Good morning. Welcome to Good News Tuesday. It is March 30, 2021. Welcome po sa programang Agenda. I'm your host, Cito Beltran, and we have lots of reasons to call it Good News Tuesday. Why? Because it is the day where the President, Rodrigo Duterte, announced to company owners to the business sector, buy all you can. Parang parang ukay-ukay online sale. Buy all you can. Pinapayagan daw, pumapayag daw si Presidente Rodrigo Duterte for companies to buy the vaccines they require directly for their employees. Kumbaga, sila na yung bibili. O may kumpanya ka, papayagan ka ng you are now allowed to buy your vaccines for your employees. So that's Good News Tuesday number 1. Number 2, there will be 1,000 peso worth of food deliveries para sa mga gipit, mga nangangailangan ng ayuda according to the IATF and according to the Budget Secretary. Excuse me po. Excuse me po. Anyway, the Budget Secretary during the cabinet meeting said that they can provide 1,000 pesos worth of ayuda sa mga nangangailangan o sa mga maapektuhan nitong ECQ up to April 4. Ang condition lang is that it would be in kind, not in cash. Good news number 3, the Anti-Red Tape Authority or ARTA, Director General Jeremiah Belhica announced that they have instructed or instructed the Food and Drug Administration to fast track. Bilis-bilisan nyo nga yung pagpapa-approve, pagparehistro ng mga gustong magtinda o mag-supply ng ivermectin din sa Pilipinas. Okay, so those of you who have been campaigning for ivermectin to become legal, the problem nga here is it's legal naman eh. You can buy it on the across the counter. Sabi nga anyway, may mga terms sila diyan sa mga butika eh. Over the counter, OTC, over the counter medicine, sabi nung ARTA, wag na nating pahabain ng kalbaryo kung may saysay yung ivermectin na yan or ivermectin, payagan na yan. And last but not the least, DOTR, nadinig ko ito kahapon, I still have to verify this, pero balita ko, sabi nung DOTR kahapon, nakikita nila na nagkukumpulan, ang daming naghihirapang mga mananakay. A lot of employees, workers were stranded last night by the time 6 p.m. rolled around, came around, and they were all waiting for somewhere to ride kasi inimpose po yung 50% ride capacity only. Sabi raw po ng DOTR, papayagan na beyond 6 p.m. We will ask the Undersecretary of the DOTR, we will ask sino na nga ba yung magiging kausap ko dito, medyo Artemio Tuazon, okay? Usec, Artemio Tuazon, pasensya ka na Usec, medyo malilimutin na ang Kuya Cito. We will ask him regarding the situation for transport under the second round of ECQ. So, we will have a lot of questions kasi alam niyo po yung sinabi kong Good News Tuesday. Those are all the good news. Kaya lang, may sabit. We need to clarify, what the President meant kung companies can buy directly, because some people have said, based on the tripartite agreement, the tripartite agreement from the very beginning suggested, hinted, recommended, required, depending on who you speak to in government, that the purchases will be such that 50% goes to government, 50% goes to the private companies. Yan ay ang problema dyan. And then itong 1,000 peso worth of food delivery sa bahay ninyo, Did somebody forget that any massive purchase of food items will require bidding? Unless, of course, there is a provision in the laws for covering emergency under COVID na will do away with the bidding. Siguro meron, no? Pero it doesn't do away with the packing. I said packing, repacking, okay? And then the distribution. Sabi nga ni kasamang Joel Reyes Sobele, mamumula na naman daw ang hasang ng mga mayor at barangay captain. Ito yung problema niyan eh. Hindi naman ginusto yan ng mga mayor, barangay captain. Ngayon, sila pa ngayon ang pagsususpetsahan. Sila pa ngayon ang paghihinalaan na sila yung makikinabang politically regarding this food distribution. Actually, truth be told, many of the people I know in the barangays and local governments, they're sick and tired of this. They don't want the added work. They already have problems. Kaya meron nga raw pong namatay na mayor yata dyan sa Laguna kahapon sa COVID. Hindi pa natin ma-verify pero sinabihan ako kahapon. So, mayors and barangay captains, they're up to their necks with problems. Another round of food distribution is just going to be such a headache. Okay, let's go to the front page of the Philippine Star this morning. Okay. Yesterday was another record-breaking day as the Health Department tallied over 10,000 new cases of COVID-19. Total active cases are now over 115,000 with a positivity rate of 18% na mas mataas, sobrang mas mataas sa recommended by the World Health Organization na dapat 5% lang po ang positivity rate. Kumbaga sa hawahan, mga 5% of general population lang. Yung 18, medyo may more than triple. Okay, the statistics of COVID cases yesterday, 10,016. Okay. Second, the first government-procured vaccines have arrived in the country. President Rodrigo Duterte himself witnessed the arrival of 1 million pesos worth 1 million doses of Sinovac shots yesterday. Okay. Now, ito naman po, no? Good news po 'yan. Pero ang bad news, sabi nung yung warden nating lahat, have you noticed that they are now using the term kulong? Kinukulong natin ang ating mamamayan, okay? They're using that term. 2-3 cabinet member na ang nadinig ko na nagsabing kung ikukulong natin o kinukulong natin ang ating mamamayan, we should make sure we feed them or we take care of them. If we are being imprisoned, detained, or are kulong, may warden. Sino ba yung warden? Yung Secretary of Health na head ng IATF. Okay, yun na title mo, boss. Okay, now, almost 23 million Filipinos affected by the ECQ in Metro Manila. Bulacan, Laguna, Cavite, and Rizal are expected to receive assistance from the government, but this time, the aid may be in kind. Nauna na ako dyan, sorry sa headlines, pero yun na nga po yung pinupunto ko. If you give, my caretaker was asking me about that this morning. Sabi ko nga, kasi nagtataka siya, bakit naaasar ako? Sabi ko, kasi pag ikaw binigyan ng 1,000 peso, yung 1,000 peso mo, gagastusin mo doon sa kabilang kanto para bumili ka ng gamit mo. O ng kanin, ng bigas, ng gulay, kung ano man. Dinatulungan mo yung kapitbahay mo. It helps distribute money and parang hinimas lang natin ng bahagya yung ekonomiya, local economies. Pero itong in-kind provided by the national government, nako po, ilang daang milyon ang nakaparada sa ngayon. There are hundreds of millions of pesos of ayuda, of subsidy that have not reached the intended recipient, hindi nila malaman kung kanino ipapadala or tinulugan. Okay? So, yun na lang po, no? Anyway, baka maubos oras natin. Mapagalitan ako ng aking executive producer. Nandito naman. Our first guest for today is someone I highly respect, someone who is an authority in his field. He is an infectious disease expert. That which makes him the head of the San Lazaro Hospital Infectious Disease Center or ewan ko kung anong tawag doon eh. Anyway, let's bring in Dr. Rontgene Solante, manggagamot ng maraming sikat na COVID. Good morning, Dr. Rontgene. Kamusta ka na?
Hi, Sir Cito. Good morning. Ito, buhay pa.
Ay, buti naman. Pareho na lang tayo. Ako, nagtatago. Ako yung wanted eh. Ikaw ba? Kayo ba nakakulong? Kayo nasa Manila eh, no?
Ganda ng background mo, ha? Farm mo yata yan.
Yan, no? Ano lang, garden lang yan. Anyway, Doc Rontgene, anong masasabi mo? What's your reaction to this Good News Tuesday pronouncements that I mentioned? Buy all you can ng vaccine, sabi raw ni Presidente. Pagkatapos yung ARTA, sinabi sa FDA, oy, bilis-bilisan nyo nga yung pagpapakawala niyang ivermectin na yan. And then itong food delivery, 1,000 peso food delivery sa mga gipit.
Yeah. So I'm really hopeful, no? Yung mas better news sa akin yung bakuna, because we are in the front line and we're really seeing extremely very high cases of COVID-19 that we haven't had seen this for several months. And even if you compare this last year's surge, this is extremely very high, and that I think the government should do something. And I have always implied this, that the sooner we can fast track the vaccination for all the priority group, I hope we can get some result of this decrease in the cases.
Mm-hmm. Okay, now, Doc Rontgene, you are an infectious disease expert. And una't-una, dyan ba sa San Lazaro, ano ba kayo? Wing, center? Ano ba tawag doon sa departamento mo? O department lang ba talaga?
Department, no? Yung department ko, we are adult. We also have pediatric infectious disease department, and then we also have the family medicine department.
Okay, now, paki-explain nga, no? Kasi minomonitor ko itong mga infectious disease all over the world. And number one, the claim or the reports indicate that the Philippines is not an isolated case. Parang globally, nagkaroon ng resurgence. So, hindi na natin pwedeng sabihin kasi pasaway ang Pilipino. Ako, pag may nadinig pa akong isang politiko nagsalitang pasaway Pilipino, nako, pipitikin ko sa ilong. Kasi it's happening all over the world. How do you explain this? What is the trigger that causes for this resurgence in Brazil, in Germany, in many parts of the world?
The number one reason now is because of these variants. And I think in some countries, the variants, like the UK variant, is now the dominant variant among these countries. And it has been always explained that when you have this variant, the risk of transmissibility is really very high, in fact, 5 to 7 more than the old variant. And that alone, if you look at that ability of the virus, this is the first time we've seen this, how transmissible this type of virus is. We haven't experienced that with other viruses like the SARS-CoV-1 or even the influenza. But this one, it somehow evade some method of even the most appropriate protection. I totally agree with you, no, that we just can't blame people that we're not wearing the mask or appropriately or non-adherent to the minimum health safety protocol. But we also have to look at how the virus behave and who are those are highly vulnerable. And we're seeing a lot of these cases. I just like to share with you. In fact, I could say 60% or 40 to 60% of our cases now are coming from household transmission. both parents are there, including their children. So that means that that ability of the virus, even if you're at home and you seem to believe nobody is there carrying the infection, particularly the asymptomatic, can be and the other factors why transmission is really important also in household transmission.
Okay, now here's something that's being debated. Medyo nakikipagkulitan na rin ako sa mga tiga DOH because when Boris Johnson, the Prime Minister of the United Kingdom, talked about the UK variant last year, if I'm not mistaken, December of last year, he said that we have determined that UK variant is 70% more contagious and deadlier. And when I mentioned that to a health official here in the Philippines, yung sabi ng tao, well, actually that has not been borne out by scientific data, blah, blah, blah. But what are we finding out now? Kasi parang ang nangyayari, the official position is kung walang pinapag-aaral, walang scientific data and analysis, hindi natin pwedeng sabihin totoo yan. But sabi nila sa UK, dangerous, deadlier, and more contagious. Now you've said it is true, it is 5 to 7 times more contagious. Is it deadlier? Kasi ang nagtataka ko, bakit ang daming asymptomatic pero hindi natin nalalaman kung mas nakakamatay?
Okay, so first I would like to explain the mechanism why a virus can be deadly. Like the virus cannot replicate without the human host. So meaning the ability of the virus to be deadly will only be dependent once he will be inside our body. Okay, and there are factors to consider when that virus becomes so virulent. One, if that virus infect an elderly. So meaning if the virus infect an elderly whose immune system is weak to prevent the replication of the virus, no? Pagkalat, no? That's one. Those who are immunocompromised, okay, can also develop more severe manifestations like HIV. Those with tuberculosis. These are actual experience here in actual patients. Those with mga malignancy, no? They can really create more severe form of the infection. Those with chronic kidney disease or even hypertension and diabetes. No? So on that aspect, I totally agree with you that we just can't say that this virus is not deadly. Although it's highly transmissible, it's not deadly. No, it's not. Once you get to see more infection, highly transmissible, then you also get to see a lot of those who get the infection that are also immunocompromised and can develop more severe infection. That's the way I look at this. The more increase in the cases, the more also vulnerable can get the infection, and that's why we have a lot of these mortalities now in most private and including government hospitals.
Okay. Now, Doc Ronjin, can you explain, no? Kasi nabanggit ko nga sa EP ko kay Gab Malyari, puyat ako, wala akong tulog, kasi may minomonitor ako yung kaibigan, kabarkada ko na pastor, who is now in one of the local hospitals here in Batangas. He is very careful. Maski na kaming dalawa, pag nagkita kami niyan, social distancing kami, pareho kaming may mask, etc. He is so paranoid about the virus. And yet, he got the virus and he's now in the ICU. And sabi ko, paano nangyayari ito na yung mga kilala kong taong napakaingat, pati sila tinatamaan? What could explain this?
Well, I think we need to look at the data again, no? Yes, I agree with you that we wear the mask, we wear the face shield, we wash our hands, but I see a lot of people still get the infection. Probably in between, we don't know where that lapse of that particular protocol was made, or probably during indoor conversation, there is a possibility that they got it. But yes, it's true, no, that we don't know anymore some of the reasons why that yung mga maingat meron pa ring natamaan, and these are some things na we need to study further, no, kung saan natin ilalagay kung ano yung mga recommendations natin. But I believe, no, ang nakita ko rin dito na we need to revisit again, no, and review the current cases dahil hindi lang namamatay yung mga elderly at saka yung may mga comorbidities. We've seen some younger patients also, fit naman, but still do develop severe and critical COVID.
Well, you're correct because the pastor I was just talking about is much, much younger than me. I'm actually, tawag nga nila sa akin, kuya, no? Kasi malayo yung agwat namin. Pero tinamaan pa rin. Now, is it possible, because medyo na-curious na ako dito, do you have any case in San Lazaro where you have two viruses in one patient? Kasi mukhang na-observe na raw yata yan abroad na beginning from Brazil to America na tinamaan ng sabay.
Yeah, correct. No, actually, we're now looking at, because we have some individuals who had COVID and who had already history of COVID before, and in fact, there was one that has already had his third COVID infection. So meaning in a span of not more than a year, he already had these three reinfections, and we're looking at. We're still sending the specimen to our partner, Nagasaki University. They can do the sequence of the three specimens. Yes, it's a possibility that there can be multiple infection in an individual with different type of the same virus, but with different mutation or different makeup.
If you get COVID, are you more susceptible to getting it again? Kasi nung una, in 2020, akala natin, pag tinamaan ka ng COVID, magkakaroon ka ng antibodies, magiging COVID-proof ka na. And science disproved that kasi maraming ang nag-return bout. But what was never addressed is whether or not those people who got COVID before have an increased probability of getting COVID again. Mas delikado pa.
Yes, that's true, because the studies will now tell us that if you recover from COVID, your antibody that can protect you against a new infection will only last, the most is 90 days. So meaning after which you can already be susceptible, and that's why that the other grim scenario here is that there will be new reinfections, especially with the new variant, because if you were infected before with the old variant, definitely you don't have the ability to protect it, the new variant. Even if you still have the antibody with you, you can have a reinfection earlier than what was earlier thought that you can be protected for 90 days. Because with this new variant, since you don't have the amount of antibody because it's a new variant, then a reinfection is also possible earlier.
Okay, Vice President Lenny Robredo, I think, was the one who was raising the issue about testing. Medyo na-surprised lang ako when you mentioned that you are sending the samples of your patients there to confirm dual or triple exposures to Nagasaki University. Bakit doon pa, Doc Rontgene? Is it because we simply don't have enough materials, logistics, and facilities in the Philippines for genome sequencing and identification of variants?
No, actually, this is only for San Lazaro Hospital, because they are our partners here in San Lazaro Hospital. We have this partnership with them for several years now, regarding enhancing also our capabilities, especially for molecular testing. And since they also have their laboratory here in San Lazaro Hospital with us, so it's easy for us to really coordinate with them. And since we also have the clinical material, our patients here, so it's easy for us to coordinate with them and look at possibilities on how we can also do some testing and do our own testing without having it sent to other centers.
Okay, I remember at one point that the Genome Center of the Philippines had mapped the first variant, the Princess of the Sea variant ba yun yung tinatawag nila. They had mapped it from Ilocos down to the Visayas or something like that. Napakita nila kung nasaan na itong first variant. with the UK variant, the South African variant, and the Brazil variant, meron na ba tayong mapping in the Philippines of how widespread these particular variant, these new variants are?
I think the Philippine Genome Center do have that particular data. I'm just not aware of how extensive it is, and including the distribution.
Okay, that's good for you to be honest about that. Now, ang isa pang tanong ko, Doc Ronjin, no, because kahapon may lumapit sa akin, actually, kapitbahay namin, at sabi sa akin, Kuyang, paki-check mo naman to kasi yung aming kamag-anak diyan sa Barangay Bulbok, kailangan dalin sa hospital. Pagdating sa hospital, hindi raw matanggap kasi punuan na dahil ang dami raw pasyente galing sa NCR Plus. And then last night, if I'm not mistaken, or this morning, I heard, this morning I heard in the news, but I think Secretary Duque said it yesterday, na pati yung regional hospitals daw napupuno kasi nga yung pasyente sa NCR pinapadala na sa region. Now, as an infectious disease expert, does this make sense? Is this logical? I know by to save lives you have no choice. But how many more lives are we putting at jeopardy by sending out those infected people to the regions?
Yeah, I think that's really the other alternative, because most hospitals now in the NCR are already full. Ang ma-advise ko lang siguro niyan, if you will be coordinating with these hospitals outside, there should be some guidance from a doctor so that when they will be traveling or they will be going to these hospitals na medyo malayo, they can also be assured that pagdating doon, hindi naman na pagdating doon wala nang vitals yung pasyente, no? And probably it's really better to have a close coordination with doctors. They can call the Department of Health or any of your private or private doctors and assess these people while at home, if these patients can still go to a longer travel, or they should be here in NCR, because I think the crucial point there is that yung pag-travel pa lang pero critical na pala yung pasyente. And maraming nangyayari na ganyan na hindi nakaabot sa hospital, nawala na talaga ng buhay because of the critical. So I think, Sir Cito, the message here is that if you have mild symptoms and you see that these patients needs medical attention, like higher risk for progression to severe, then you have to coordinate closely with your doctors now and get some advice how they can go about in terms of monitoring the mild symptoms among those who are high risk, what we call highly vulnerable. Because it always starts with mild symptoms before they will go to moderate or severe critical symptoms.
Okay. Now, yung sa vaccines, Doc Ronjin, because someone pointed this out to me. Sito, yung vaccines, 1 million dumating. Pero yung Sinovac, no less than the Secretary of Health said, hindi pwedeng gamitin sa mga senior citizens kasi hindi nag-test yan sa senior citizens. And then now, the government is saying, we will use it for senior citizens and people with comorbidities. Parang shouldn't we simply wait for vaccines that were tested on senior citizens rather than just disperse all of this because of a desperate attempt to protect the senior citizens? Medyo conflicted kasi maraming nagtatanong conflicted sila dyan, Doc Ronjin
Okay, so klaruhin lang natin, no? First of all, I think the Philippines is the only country that gave the recommendation that Sinovac is not for 60 years old or elderly or those with comorbidities, no? Dahil nga doon sa data na pinakita sa atin na wala silang nakitang efficacy data sa 60 years old and above and those with comorbidities. Ang take ko dito is that being an infectious disease and also being into vaccination for several years now, no? That doesn't always mean that if you don't have that study to say that you are not effective, in the 60 years old and comorbidities. You look at the phase 1, you look at the phase 2 studies. They have phase 2 studies that the immunogenicity, yung pag nung binigay nila sa mga konting tao and 60 years old and above, maganda ang immunogenicity ng bakuna, even among the elderly. And we know that if you are elderly, if the vaccine works among this elderly population, then we always surmise that it will also work against those with comorbidities. So parang pinagdugtong-dugtong na yung data na yan na you can use it, na especially at this point in time na wala pang bakunang masyadong dumarating, and then our really objective is to vaccinate as many as possible, especially for the priority population. So rather than not giving them any protection, then you have to give them so that you may have an amount of protection, 50, 60%, then that in itself is already a big benefit for this highly vulnerable population.
Okay, last question, Doc Rontgene, yung ivermectin, mectrin ba yun? Ivermectin. Anong masasabi mo? Because the ARTA said to FDA, oy, bilis-bilisan ninyo yung pagre-release ng listing and certification ba yun? Doc Rontgene.
Okay, so I would still stand by on my thought on this. No, this has not yet been approved by big clinical societies, no, like IDSA or even PSMID, because of the low data that it is really beneficial for patients with COVID-19. So if you use ivermectin, I would say it should be under a close supervision of your doctor, and if it will be approved by FDA for use against COVID-19, then again, it should be under close supervision of your doctor, and for anything that will happen to you, always have to monitor any side effect, and always be because as of now, no, this drug doesn't have any yet good proof that it can be a treatment for COVID.
Yeah, for its prescribed application, it is a deworming medicine. Kanya sumikat yan, ginamit yan sa Ghana ba yun or somewhere for river blindness dahil maraming mga batang nabulag dahil sa bulati. Now, sa mga nakausap ko, no, and these are not, ordinary people, mga sikat na tao who have told me, yung iba nga unsolicited, mini-message ako Cito, we have used ivermectin as a prophylactic, me, my family, etc., etc. Pati si Senator Juan Ponce Enrile, sabi niya, he will be legal counsel for the doctors for ivermectin. My question is, because obviously the dosing is not daily. Hindi nga daily, parang every so many weeks lang or whatever. Pagkatapos, napakaliit ng mga dosage, depende kung gaano kataba ka o gaano ka kabigat. Meron ba talagang, are there known adverse side effects that is very common, that happens regularly, that would cause apprehension for you medical practitioners?
Yes, of course. No, because this is the first time that will be, if ever there will be, it will be licensed to be prescribed, then this will be the first time that this drug will be used widely. And in the past, ang binibigyan lang dito, sabi na nga natin, sa deworming, napaka-konti ng mga pasyente at saka hindi naman natin routinely binibigay yan. But we still observe for mga adverse event. Paano pa kaya kung ang dami nang bibigyan nito, and the more na we should be monitoring them, no, because of the adverse event, even the minor or the little dose or the kung isang beses lang yan inumin sa isang linggo, something like that, there will still always be an adverse event, Sir Cito.
Okay, well, I will leave it at that, Doc Rontgene. I suppose naman kasi hindi ka pa gumagamit ng Viagra di ba? Now, the joke there is, di ba, Viagra kasi was never intended to be for di ba, dysfunction. It was intended for flow of blood yata or something. Hindi ako gumagamit Kanya lang that was the perspective. Anyway, Doc Rontgene, thank you very much. Mag-ingat po kayo, and we salute you. We salute all of the people in San Lazaro. Alam po namin kayo ang mga bayani. May God bless and reward all of you. Thank you very much.
Thank you, Sir Cito. Salamat.
Okay, that's our infectious disease expert, head of the infectious disease department of San Lazaro Hospital, Dr. Rontgene Solante. We'll go for a quick break. We'll be right back here on Agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran. And para po doon sa inyong naiinggit, dahil ako ay nasa garden, nasa farm, wag po kayong mainggit. Kasi ito lang po ang aming paraan para self-isolate, kumbaga, to protect ourselves. Because even here in the city of Lipa, from what I understand, I read a circular yesterday, nag-declare na rin sila ng ECQ. Dahil nga po, napakarami ring mga tinamaan ng COVID cases sa Lipa, primarily because many Lipeños go to Metro Manila, Laguna, then sa may Santa Rosa, to the industrial parks to work. And ayan na po, nagkakahawahan na. So, si Mayor Africa ay naghigpit na at ngayon ay binabantayan na yung paglabas ng maraming tao. So, wag kayong maiinggit, ha? Maganda lang yung background natin. Kumbaga sabi niya, sino ba si Arnel Ignacio ba yung nagsabi to na magaling lang po ako sa packaging. Ayun. Okay, let's go to our next guest. None other than Undersecretary Artemio Tuazon, the Usec for Transportation from the Department of Transportation. Usec Tuazon, good morning, sir.
Good morning, Sir Cito, and good morning to all your televiewers.
Okay, Usec, your response, thoughts on the first day of ECQ yesterday. Medyo nagkabulagaan, marami ang na-stranded. And then I heard a report late in the late in the afternoon that the DOTR in response doon sa maraming na-stranded ay pumayag na patakbuhin yung mga public transport past the curfew hours.
Yes, sir. Sir, first of all, before I answer you, I'd like to inform everybody that the capacity of our public utility transportation has not been changed. We're still allowing basically the same number of people to ride our modes of public transportation. Also, the number of units that we have allowed to go out and operate are still the same. If there are any changes, it would be on the stricter implementation of the 7 commandments in public transportation or the minimum health protocols. As on your question, sir, that there seems to be a shortage of public transportation, we looked into it and we saw several possible reasons why medyo nahirapan po yung ating mga mamamayan na makasakay po sa ating pampublikong transportasyon. Ang isa po dyan, one of the reasons there is that because of the checkpoints in the boundaries of NCR Plus and within the NCR Plus, nadi-delay po yung turnaround time ng ating mga public utility vehicles. So it takes longer for them to make their rounds, and because of the delay, there's an accumulation of passengers on the stops. The other is because we're actually on ECQ and it's Holy Week. Some of our operators thought that there would not be enough passengers for them to operate. It will not be viable for them to operate. Kaya yung karamihan po ay hindi po lumabas. Ngayon, that is the reason why si Secretary Tugade has been always espousing and is encouraging all our public utility buses and our public utility jeeps to join the service contracting program po of the DOTR and LTFRB. At least they will be assured of their income when they go out on the routes, and the income will go a long way as far as sustaining them also. The other reason, which we also saw, is that because up to now, sir, despite the fact that we had announced several times already that only authorized persons out of residences or APORs are the ones allowed to ride the public transport, marami pa rin po tayong mga kababayan at mamamayan na lumabas at umaasa po na makasakay sa ating public transport. This caused a clogging of the terminals and also of the stops. And we told them already that they will not be allowed to ride the public transport. Only APORs are allowed to ride the public transport. These are the reasons we saw why there seems to be a lack of public transport yesterday. Now, the LTFRB had already talked to our operators and instructed them na lumabas na po sila at pumasada na po sila. And if they still refuse to go out and fly their routes, a show cause order will be issued against them, and if proven that their refusal is not warranted, then they may either be fined or their certificate of public convenience may be recalled or revoked.
Okay. The big issue yesterday was the 50% ruling. Pakilinaw lang, Usec, ano? Kasi parang dumating sa maraming tao, binago. So, for the longest time, it has always been 50% capacity only.
That is right, sir. We did not change the capacity. Wala po tayong binawasan. We did not reduce or change it. It has been 50% even before ECQ.
Okay, so kumbaga yung DOTR matagal na 50%. Yung mga jeepney driver nag 100%. So pinababa ngayon. Now, what is our solution? Will the extent, kasi pakilinaw mo lang nga yung nabalitaan ko na yon, that because of the stranded passengers last night, 6 p.m., pwede na mag-operate yung mga utility vehicles, public utility vehicles beyond or into the curfew. Now, how long into the curfew are they allowed? Dahil puro APOR naman yung pasahero eh.
Let me clarify that, sir. No, ang ating public utility vehicles are not covered by the curfew. They can operate even during the curfew hours. Because precisely, sir.
Mabuti na lang sinabi mo yan, Usec, kasi honestly, ako nasa media na, pati ako, akala ko sila covered din eh. Siguro yun ang kailangan nating ulit-ulitin, na yung public utility, jeepney, bus, pati ba tricycle?
Yes po. Ang tricycles daw po are under the LGUs. They are not under the DOT.
Okay. O sige, so bus, jeepney, hindi sila covered by the curfew. So pwedeng pumasada, hindi dapat inaaresto ng mga nasa checkpoint.
Yes, sir. Kasi po naman, ang sakay lang po nila are also APORs. Kaya po, allowed po din exempted din po ang ating mga APOR sa curfew hours. Kaya they should not be stopped from doing the routes po.
Ngayon, obviously may nagkakatakutan din. Hindi intimidation, but many people are honestly afraid to go out. So even some of the drivers na monitor ko medyo nag-aalinlangan daw pumasada kasi sabi baka mahawa kami, sa bahay na lang kami, papasada ka, kikita ka ng pangkanin at ulam lang, sa bahay na lang kami at baka matodas pa kami dyan sa pagbiyahe-biyahe.
Yes, sir. Siguro po, we have to remember, sir, na yung prangkisa na binibigay sa kanila ng LTFRB is actually it's not a right. It's more of a privilege for them to operate their public utility vehicles. Kaya nga po, ito po ay serbisyo sa publiko, kaya dapat po ito ay kanilang ituloy lang. Ngayon po, kaya nga po, katulad ng nasabi ko kanina, Secretary Tugade has always been encouraging everybody and espousing that they join the service contracting program of the
Yeah.
LTFRB. Kasi under the service contracting program, they will be paid per kilometer run. They will not be paid per the number of passengers that they have. So regardless of the number of passengers they have, they will be paid on the number of kilometers that they run. So they should not be afraid anymore for these things.
Ay sulit ba yun na Usec? Kasi you know naman how some people think, no? Baka mamaya magparehistro ko dyan. Pag narehistro ko dyan, biglang nasa listahan na ako ng mga wanted. Wanted para pakilo yung aking jeepney o yung aking bus at gusto ma-modernize kami. And number one. Number two, sulit ba na mag-register dyan sa service contracting scheme na yan if we compare it to average number of passengers per run?
Yes, sir. I think po naman mas okay po dito sa ating service contracting program. Number one, sir, kasi like I said, regardless of the number of passengers you have on board, you will still be paid the same amount for the number of kilometers that you run. So whether may pasahero ka or wala, mababayaran po kayo based on the number of kilometers run. Opo. Ngayon, kung hindi po
pasensya ka
kayo
na. Pasensya ka na, hindi ko pala na-get yun. So, bali, kung may masakay akong 10, kukubrahin ko yung bayad ng pasahero, pero babayaran pa rin niyo ako sa DOTR for the distance na binyahe ko sa ruta ko.
Tama po yan.
So, doble lagari ako. Para palang lagaring hapon yung mangyayari dyan.
Hindi naman po, sir. Kasi po, they will be paid of the total fares collected. They will be paid lang on the kilometer that they run, sir.
Oo nga, oo. So, doble ang kita.
Opo. Maidagdag ko na rin po, sir, no? Wala po tayong fare increase ngayong ECQ, ha? So, kung meron pong naniningil po ng mas mataas na pamasahe, ay i-report lang po sa amin sa DOTR tsaka sa LTFRB. Wala po tayong fare increase ngayon.
Okay, now, Usec, maiba lang ako ng topic, no? I just need to clarify this because as I was monitoring the news this morning, I found out that a particular station of the MRT ba yun? O LRT, parang sinat down dahil ang daming nahawang mga teller, etc. Now, has the DOTR conducted or enlisted the service of a research group to find out saan ba talaga nagkakahawahan? Kasi parang halos wala naman kaming nadinig. I have not heard of any case of, traceable infection dahil doon sa jeepney ba? Kasi sa bagay, hindi mo naman makakocontact trace yung mga nasa jeep. Wala namang registration yun, ng pasahero. Pero parang lumalabas mas madalas at madalas na mga train operators, utility, mga nasa tellers ang tinatamaan ng COVID. Pero sa mga bus at jeep, parang may nababalitaan ba kayong tinatamaan na mga driver? May mga cooperatives ba na nagsasabing kasi bumiyahe yung mga super namin tinamaan ng COVID?
Sir, unang-una po, meron po tayong contact tracing app na ginagamit sa public transportation po. Yun yung pong Trace. We are using it now. We are implementing it into the different modes of transportation. Pangalawa, sir, yung tinatanong nyo kung meron po kaming hinire na separate agency or separate group to do that for us, sir, the DOH is actually the one undertaking that for the government, sir. Meron po silang group na nagmo-monitor ng data, and so far nga po, sir, wala pa pong nabibigay na data sa amin na meron transmission sa ating public transportation. Siguro po ang isang dahilan po rito because po ang ating mga jeeps are mostly open air po.
Correct.
It helps in preventing the transmission of the virus po, yung ventilation.
Hindi kaya maganda. Naku, may magmumurahin ako ng iba dyan. Pero I think you know where I'm coming from. Hindi kaya mas maganda pagtatanggalin na lang natin yung mga bintana yung mga train na yan. Kasi parang naka-aircon ka nga. 100% naman natatamaan ka ng COVID nung katabi mo. Baka mas maganda pang i-open ventilation na yung mga train na yan. Makakatipid pa kayo sa kuryente.
Actually, sir, yung ventilation talaga po is very important to prevent the transmission of the virus. Kaso lang po, meron din po tayong safety and engineering issues pag tinanggal po natin yung mga bintana. Medyo
ay,
delikado rin po.
kasi, nako, naghang si Usec. Sana wag magtuloy-tuloy yung hang na yon. Pero kasi, alam niyo mga kaibigan, baka sabihin niyo, nako kuyang, si Raulo ko talaga. Hindi po, kasi hindi kayo nakatikim ng tren na ang bintana ay chicken wire. Lumaki kasi ako dyan, nakatikim ako noon na nung minsan sumakay nga ako mula Agdangan, Quezon, hanggang dyan sa South Super Highway. Sumakay kami ng tren dyan. Nako, ang sleeper cabin ng sinakyan namin. Anong year ba yun? 1979 yata yun. Sleeper cabin ng PNR. Matutulog ka doon sa daanan ng tao. Higa ka doon sa swelo. Pero doon po, nilalagay doon mga chicken wire, no? Kasi naman yung mga walang hiya dyan, kung ano-ano, kumisan, pag nagising sila ng madaling araw, binabato yung tren dahil na-istorbo raw yung pagtulog nila. Pero yung manok nila, hindi nila binabato pag tilaok ng tilaok. Anyway, we will try to reconnect with Usec, Usec Tuazon. We'll go for a quick break and we'll be right back here on Agenda. Okay, you're back here on Agenda. I'm your host, Cito Beltran. Welcome po sa mga subscribers ng Signal TV and welcome back, Usec Tuazon. Matanong lang namin, Usec, kasi ito may nagpapatanong dito. Yung MRT raw po ay sarado Tuesday while yung LRT 1 and 2 will only operate until today. So, madaling salita, finish or not finish, walang tatakbo. Paano na ngayon yung mga kailangang gumalaw na wala namang sariling sasakyan? Yung bang mga bus, jeepney, etc., how will we augment the needed transport?
Yes, sir. Sir, yung I answer that, sir. Sir, yung ating pagsasara po ng MRT, LRT1, LRT2 at saka ng PNR po, yun ay programmed annual maintenance shutdown po nila. So, every year po ginagawa po yun. Ngayon, doon sa ano po natin, sa tanong natin, whether we can help augment the number of passengers, public transportation because of the closure of the rail system, tama po, I'd like to inform everyone that yung ating free ride for health workers natin, medical health workers, is still ongoing po. We actually have 20 routes right now which are operating, and more or less we have already helped about more than 2 million health workers get to work. Other than that, we have the EDSA carousel service under the MRT, which will also be an alternative transportation mode for our commuters aside from the MRT.
Kahit na Good Friday, Usec Tuazon.
Yes, sir. Meron po yan. And the LTFRB will actually be increasing the number of units for this for the EDSA carousel po. And lastly po, sir, if I can inform them, only yesterday we already started the free rides for appers ng ating mga modernized jeeps. Pwede na po sila. May libreng sakay na rin po sila. There are actually 44 routes that will be operating. These modernized jeeps will have the signage which will say that free ride for appors. And all they have to do is show them their identification cards to prove that they are appors, and they will be given free rides. It will be operating from 4 a.m. to, I think, 10 p.m., sir. It will be
Okay.
operating. So marami rin pong alternative tayo doon sa ating rail system.
So maliban doon sa 50% capacity, tutuloy pa rin ba yung one seat apart sa mga bus?
Yes, sir. That is the capacity even previous to the ECQ, sir. So tuloy lang po yun. We will continue with the same capacity.
Okay, well, I will end it at that, Usec Tuazon, unless meron ka pang gustong ipaabot sa mga mananakay because alam nyo, mga kaibigan, baka akala ninyo porque Good Friday, lahat tahimik. Marami pong mga nagtatrabaho sa mga call center at saka sa mga hospital, mga vital installations na walang Biyernes Santo. May Diyos naman sila, kanya lang yung trabaho nila walang pahinga dahil vital requirements sila ng industriya at ng publiko. So Usec Tuazon, anything else?
Yes, sir. If I may be allowed, sir, alam po natin na mahirap po itong pag-implement nito. Napakarami po na ating publikong sasakyan at marami pong babantayan. Hindi po kaya ng gobyerno lang ang magbantay dito. Kaya po si Secretary Art Tugade has always been asking for the cooperation ng ating mga commuting public at ang ating mga citizens na tulong-tulong po tayo dito. Pag tayo po ay hindi apor at kailangan po magstay at home, huwag na po tayong lumabas. Kasi nakakadagdag lang po tayo sa congestion. At the same time po, we are exposing ourselves unnecessarily to the virus kasi po pag may congestion area po sa ating mga pampublikong sasakyan, the transmission of the virus. So si Secretary Tugade would like to ask the cooperation and help of all our citizens and all our riding public within the NCR Plus bubble to please cooperate with the guidelines of the public transportation. Thank you, sir.
Tama po kayo dyan, Usec, kasi madali tayong magkulitan at mag-aasaran sa maluwag-luwag at maayos-ayos na panahon. But now is not the time. Today, we help each other. Thank you very much, and please give my warmest regards to Secretary Tugade at pakisabi sa kanya, siya mag-ingat, ha? Ilang beses na rin siyang namontik-montikanan. Thank you very much.
Thank you, sir. Thank you very much too.
Okay, yan po si Undersecretary Artemio Tuazon ng DOTR. So, yun po, no? Wala naman talagang nagbago eh. Yung 50% seating capacity, sa totoo lang, nandiyan na yan. Kanya lang, kumbaga, well, kasalanan nating lahat. Kasalanan ng gobyerno, kasalanan ng mga operator, ng driver, ng pasahero. Kasi, nagluwag tayo, akala natin, mukhang makakalusot na tayo. Hindi po tayo nakalusot kasi itong tinamaan ng ewan. Sabi nga ni Jolly pa na dati namin kasama sa UP, ngala-ngala naman yung COVID na yan, akala natin we were going to beat it. Ayun, tayo ang binugbog. Please take care. Just pray. Ako po naniniwala sa dasal. Yung aking kaibigang pastor is recovering. Nagte-text na nga sa akin, kakain na kami ng Korean. Korean, pag wala ng ECQ din sa Lipa. Thank you very much. God bless all of you. Continue praying. We will see the light with the help of the Lord. Thank you.